Well, hello and good morning again. I'm Leonardo McClarty and president of the Howard County Chamber, and like to thank those of you that have joined us this morning for our information session on a new health program that the Chamber is rolling out. And so we know that health insurance is one of those expenses that continue to rise, and that for many business owners or managers of various organizations or businesses, that again is something that you continue to monitor. And so we've been constantly trying to find just new programs that can save our members money on things that they have to acquire each and every day. And so certainly health insurance for our employees and staff is one of those. And so we think we may have found something that will provide additional benefit to our members. And so excited to be introducing this program today through World Insurance Agency. And so we have with us Terence Gorman, who is the representative from World Insurance, and he's going to be sharing with us how the program works, answering any and all questions that you have, because certainly we know that there's probably a number of questions that you have about this particular program as you go through the open enrollment period yourself, whether that's for you or for clients or what have you. And so with that, I am going to get ready to turn the screen over to Terence, who will actually share his screen on his end. And then ultimately we'll get started. And again, this is going to be, excuse me, an informal, I guess, conversation or what have you. So don't feel like you need to wait to the end to be able to ask questions. Certainly you can put any questions that you might have in the Q&A, or I'll be watching the chat feature as well, and actually can be able to unmute you if you'd like to just ask the question aloud, as opposed to having to type it and so forth. And so with that, I'm going to get ready to turn things over to Terence. And Terence, give me just a second to make sure that you can actually share your screen. Okay. You should be good on that end. And so the screen is yours.
Okay, there's the presentation. And let's move it to see if we have technical challenges today. See if I can do it there we go. Look at that. Very good. I was able to handle some technical issues without having my children involved to help me. Good morning, everybody. Thanks for taking time out of your very busy schedules to join us today. I am Terence Gorman. Thank you, Leonardo, for introducing me. And Leonardo brings up a very good point, and I always start these presentations because oftentimes I hear a member of an organization such as the Howard County Chamber of Commerce say, well, why would you want to get involved in offering us a health insurance program? And Leonardo hit on it. Quite frankly, it's because they're listening to their members and they're hearing about the challenges that you guys as business owners face on a daily basis. And one of the biggest challenges, and has been for quite some time, is providing your employees with health insurance. In fact, for many small to mid-sized businesses, the cost of providing health insurance can be the second or third largest expense on your P&L statement. And it seems to be something that just keeps getting bigger and bigger every year. And in the small to mid-sized businesses, it's very, very challenging for the business owner to budget for what's coming next year, because one never knows whether this is going to be the year we get a 4% increase, or is this the year we get a 15%, or God forbid, a 22%. You know, World Insurance is a growing organization, and I run the employee benefits division, and I have a call every other Monday morning with all of my producers, and we kind of go around and talk about what we're seeing in the different parts of the country where people are, et cetera, et cetera. And so this past Monday, when I was having a conversation with my guys, I said, you know, tell me, what are you guys seeing is in the way of rate increases? Because I've been hearing a wide variety of numbers, and in different parts of the country, we heard rate increases in the small market as low as 2% to as high as 25% in other parts of the country. And that is not unusual in the small group market. And it's just, it's a challenge, and it's a challenge for business owners. So by coming together in Howard County Chamber, deciding to sponsor a program like this and giving a number of small businesses the opportunity to aggregate all their lives and be looked at as one large group, you're going to take a lot of the unknowing out of it. In addition to saving money right up front, you'll take a lot of the not knowing what's coming down the road, and not having any control over your expenses going forward. So with that, a little bit about me. I have been in the employee benefits arena for 25 plus years. I'm amongst friends, so I'll let you know that I've been saying 25 plus for a couple of years now, and I'll continue to say 25 plus. I've just kind of frozen it at that number. And my focus is and has always been in the mid to larger group programs, and putting together plans for employers or groups of employers where we can implement risk management strategies to not just flatten your costs, but in some cases to drive costs down. And it's a challenge in this marketplace, but it is possible with the right programs to help you reduce your costs as you go forward and continue to reduce your costs. A little bit about world insurance. In 2019, we made it into the top 100 insurance agencies in the country's list. In fact, due to our growth through both organically and through acquisitions, we have recently broken into the top 100 insurance brokers in the country, and our business plan is to continue to grow, and the goal is to be in the top 20 within 4 years. We are headquartered in New Jersey, but we do have offices in Maryland, in the DC area, in Virginia. So we are in your backyard. And finally, we have a partner in this venture, Health Cooperative Strategies. A little over a year ago, a religious organization based in Maryland and Delaware came to us and said, we have, our organization is 540 approximately independent churches that employ some 2,600 people amongst all those 540 churches, but each one of them has to buy their health insurance on their own. And they're either buying it in the small group market, or if it's just the pastor and his wife, they're buying it on the individual exchange. And it's very difficult. The costs are just out of control. Is there anything that you can do to help us and to aggregate all these lives and maybe come up with a better program for our churches and save them some money? So this was not a business that we were in. So I went out to try to find some organizations that were in this business. And I actually interviewed 5 different organizations around the country that specialized in putting together association health plans. I ended up choosing Health Cooperative Strategies. They're based in Atlanta, Georgia. They've been doing this for well over 10 years. For the first 7 or 8 years of their existence, all they did was develop and manage what are known as multiple employer welfare association plans, or MIWAs. And that was their model, but they recognized that there were many organizations that wanted to put something together that did not fit the MIWA model. So working at that point in time with Aetna and the third-party administrator that Aetna owns, Meritain, they developed this platform, an affinity platform, if you will, utilizing a level funded program that allows them to offer this plan in all 50 states. And so they were the company that found this program, and that there are now some other organizations out there that have copied it. But Health Cooperative Strategies is an excellent partner, and they've been doing good work. And in the last 3 years, they put 50 of these affinity type programs on the books, and they're all doing very well. So when we sit down oftentimes with our small to mid-sized clients, I hear a lot of different frustrations and different questions, and the frustration is always around having no control over what's happening with their premium dollars. In fact, I did one time have a client say, you know, do these insurance carriers, what do they, when it's renewal time, what do they have, a roulette wheel in their office and they spin the wheel and wherever the ball lands, that's what my increase is? It doesn't make any sense. You know, I have a young population. I know all of my employees, and to be honest with you, I know their families. We're not that big of a company, and I know nobody's had any kind of health problems. I would know about it if any of my employees or their family members were having major health problems. He says, and yet they come to me this year and they want a 16% increase. It just doesn't make any sense. I don't think we're spending anywhere near as much as we're paying. And that is a frustration. And when you're in the small group or the individual fully insured market, your premium dollars are going to a lot of places that are not necessarily helping pay your organization's claims. Place number one is carrier profit. And the Affordable Care Act in the small group arena basically allowed insurance carriers to make a 15% profit. And at the time, it also disincentivized any of those insurance carriers from trying to help keep hospital costs down. So that's built into your fully insured premiums that you're paying on a monthly basis. Premium tax to the state of Maryland is built into the health insurance premiums that you're paying on a monthly basis. And then the other is the anticipated employer risk. And when you're in the small group market, you're in a pool. And what you're doing as an employer is you're helping subsidize other, perhaps less healthy and older groups that are in your same zip code area and your same region. And so you're paying your premium dollars, and some of your premium dollars are being used to pay your premium, pay your employees' claims, but many of them are being used for things that have nothing to do with your business. And it can be very frustrating for a business owner. What this program is going to allow the participating members of Howard County Chamber of Commerce to do is take control over how their money is spent. And how do we do that? Is we are utilizing what is known as a level funded insurance program. Level funding is a type of self-insurance, and therefore this program is governed by the rules of ERISA and the Department of Labor. But it is the safest, most conservative type of self-insurance that one can get. And I'll explain what that means as we go forward here. But bottom line with this program, when you pay a premium dollar to the Howard County Health Chamber of Commerce Health Plan, your dollar is going to be divided amongst three different buckets. The first bucket, the smallest one, is plan administration. We're going to hire a third-party administrator to handle the day-to-day aspects and functions of the program. This third-party administrator is going to issue the insurance ID cards. When a doctor's office or a hospital calls to verify coverage, this third-party administrator is going to verify your employees' coverage. They're going to be paying the claims. Importantly, they're going to audit claims. When hospital claims come in, when in-facility claims, the smallest number of claims, but the biggest dollar claims come in to be paid, they're going to scrutinize those claims to make sure that your employee, this plan is not paying $200 for a Tylenol. This plan is not paying for perhaps a doctor to have come in and checked the chart that had nothing to do with whatever the patient was in the facility for. This audit is going to make sure that we're paying the right amount of money for the claims that are being presented. The next bucket is stop loss insurance. We purchase stop loss insurance on the overall program, and this protects the program from the big unexpected claims. It protects the program from blowing up. What we don't want to do is get a whole bunch of people to come into the program at great rates because they have savings, and then next year we have to increase the cost by 30% because we had very high claims. We have stop loss insurance to help protect against that. And finally, the third bucket, the biggest bucket, is the claims account bucket. And that is where your regular doctor's visits and procedures anticipated are going to be paid out of the claims account bucket. The really, really good news with this program is that bucket, that money, belongs to all the participants of the program. And so at the end of the year, if there's dollars left in that claims account, those dollars aren't part of an insurance carrier's profit. Those dollars come back to you, all the participating members, and they usually come back in the form of a rate reduction for the next year. So those are the three major components to this program, and we'll get into it a little bit more as we go forward. But just a couple things so that you guys fully understand. This is not a sharing plan. This is not one of those short-term medical plans that the current administration started allowing as they look to dismantle the Affordable Care Act. This is comprehensive health insurance that uses Cigna's national network. And the national network is the key. It's not just Cigna's network in the Maryland, Virginia region. It is their national network. So what that means is that if you have a child that's in college somewhere out of state and they need to go to a hospital or they need to see a doctor and they're covered under your program, as long as they're going to a Cigna participating physician, this program is going to work very well for them. They'll be in network and they'll pay the typical copay that of whatever plan your organization has chosen for its employees. So we plan to have this program go effective on January 1st, 2021. In order for that to happen, we need to get a certain number of lives to go through the underwriting process by about the middle of November. But let's assume that's going to happen. If that indeed does happen, the plan goes effective on January 1st of 2021. The rates are fixed through January 1st of 2022. There is nothing that can change the rates during the course of the first 12 months of the program. And then when they renew on January 2022, whatever the new rates are, they will be set for the next 12 months. Now let's just, for the sake of an example, say, let's say we don't get the number of lives that we need by November 15th in order to get the underwriting done. And we have to extend the initial part of the enrollment period a couple of weeks, and that pushes us into February. There's a bullet there that says deductible credit for eligible new groups. And what that means is if you move into this program off cycle, off January 1, off a calendar year cycle, and there's great savings, you want to do it, but you're reluctant to do it because you'll say, oh, I know that, John over here has already paid his full deductible, and Mary not only paid her deductible, but she's also just about hit her out-of-pocket max. I don't want to hurt John and Mary. Well, you're not going to by making this move. What we're able to do with this program is if you move in off cycle, any employee that's already met a portion or all of their deductible or their out-of-pocket maximums will get full credit for that. We'll work with your current carrier to get a report that will be set up in the system so that nobody loses by moving to off cycle. But hopefully we'll get enough participation in the first phase of this that people are looking to see if they can save some money, that we'll be able to get this thing off the ground for 1/1/2021, and in which case we're going to have rates guaranteed through 1/1 of 2022. Again, this is level funded program. What that means, if claims are lower than what the underwriters expect in the first year, we'll have leftover funds. They're your funds, and typically we use them to reduce everyone's rates for the next year. Conversely, if claims are much higher than expected, that's where the stop loss insurance kicks in, and there are no additional costs to any of the existing members. So there's no situation ever where the plan can come back and say, you know what, we really underestimated last year's premiums. We need to get more money from you. That cannot happen. So you have the upside, the best parts of self-insurance in that if claims are low, you're gonna reap the reward. If claims are high, we have stop loss insurance to protect you, and there's no damage done. Important point to understand. So bottom line, how does this work? The plan behaves like traditional fully insured health plans. You provide your level monthly payment. We handle all the details. Your monthly premium will be set for whatever plan design you choose. And we're going to get into that in just a minute here. And the only way that your monthly premium could change in the course of the year is if you add an employee, your premium is going to go up for that new employee, or an employee moves off the plan, your premium is going to go down. Once the rates are set, you're locked in for the full year. You get the savings and the simplicity. We manage everything and give you a high level of service. So we recognize that one size does not fit all. So there are 700 different member companies in Howard County Chamber of Commerce. Obviously, we need more than one plan design option because what's good for one organization is not necessarily the best fit for another organization. So we have over 200 different plan designs. We're not going to make all 200 available to you because that would just be a logistical nightmare for everybody. But we'll choose, working with the chamber and the chamber's members, we'll choose 5 or 6 different plan design options that will cover a wide array of needs. We have deductible options as low as $500 to $750. We have deductible options as high as $5,000. We have co-insurance options of 100, 90, and 80% after the deductibles met. We have multiple co-pay options for office visits as low as $20 to see your primary care physician and $30 to see a specialist, up to $50 to see a physician. So there's a wide array. We'll make a number of options available, and you, the business owner, will choose the plan or the plans that make the most sense for your organization and your organization's employees. In addition, if you're currently or you wish to offer a health savings account or a health reimbursement arrangement, we can administer that as well at no additional cost. I talked earlier, we utilize the Cigna National Network. So we have pre-negotiated discounts for physicians and hospitals, and there is also out-of-network coverage available if it's needed and wanted. In addition, we move over to the right side, to the other column, and we have a few bells and whistles that aren't necessarily commonplace in the small group arena. My favorite is the medical concierge advocacy service. I work with a lot of larger employers, and when they decide to move from a fully insured program into some type of self-insured type program, the first feature that I always put into one of their programs is a medical advocacy concierge service. And this is a service that's there and available to every single member to help walk them through the maze of medical decisions that they may have to deal with. An individual gets a diagnosis and they're confused. They don't know what's the best facility for this, who's the best doctor for this, what's the best form of treatment. I don't know what to do. They can reach out to this advocacy service. The advocacy service can walk them through all the different options that are available to them, help them know what the various grading levels are for the hospitals in the area, who are the doctors that have the best results, the least amount of readmittances or complications from surgeries. All these grades are available, and the advocacy service can work with the members to help them make the best choice. And then once they've decided the direction they want to go, the advocacy service can reach out on their behalf and set an appointment for them and help them through the entire process. So that's a great tool that's available as part of this program. Teledoc services. If you didn't hear of Teledoc services prior to the pandemic that we're living through right now, you've probably heard of it now. Teledoc is something that's been around for a long time, but had incredibly low utilization prior to the COVID-19 pandemic. It's gotten a lot more use over the course of the last 7 months. And it's quite simply the ability for you, it's a Saturday evening, the urgent care facilities are closed, you've been feeling lousy all day, and finally it's really caught up to you. You have access to a doctor at 24/7. You can call them up, you FaceTime with them, you talk to them about your symptoms. Maybe you turn them the flashlight on your iPhone and have them look down your throat. And in often cases, they can call a prescription into your local pharmacy so that you can get some medicine and you're on the road to recovery before you're even able to get in to see your primary care physician as a follow-up. So it's a great service that's there. I expect that it'll be used a lot more as we go forward in this new world that we're living in. With all 200 plan design options that are available out there, we have all the preventive care coverages that are required by the Affordable Care Act. We can also provide COBRA administration so that when an employee leaves your organization and they need to be given the opportunity to take their coverage with them and keep it for 18 months, we can handle all of that administration. And we have a number of different options for emergency room copays and advanced imaging, et cetera. So just, and I hate to keep repeating myself, but just so you truly understand, this is the level funded program has one predictable monthly payment. That payment's set for the year. The only way it changes is if your enrollment changes. We take care of plan administration, account management. You're going to have multiple levels of account management. Every one of your employees on their insurance ID card, they'll have an 800 number to call with questions, with concerns, with whatever. You'll all have my phone number to call. You have the marketing pieces has my office phone number on it. Well, since COVID, I'm not in my office as much as I used to be. So my office phone is automatically forwarded to my cell phone. So basically you have me, I won't say 24/7 because I do turn my phone off at night when I go to bed, unless of course my kids are out, then I leave it on. But you'll have access to me if one of your employees' issues is not getting resolved as quickly as you think it should be. And if I can't get it done, well, I have the CEO of Health Cooperative Strategies on speed dial, and Health Cooperative Strategies has tens of thousands of lives with these various TPAs that they use, and they have a great deal of pull. They can usually get things done pretty quickly. So here's where we get to the biggest challenge of this program. And the biggest challenge of this program is the multi-step enrollment process. So step one is understanding what the risk is. And that is what we need to do is we need to get an idea of which organizations think they may like to participate in this program. And obviously they're only going to want to participate if there's savings and they feel that the benefits are just as good and they can save money. And we understand that, and that makes sense. Well, the first step is to find out if we can have savings, and that is to get the rate set. In order to get the rate set, what we need to do is understand what the risk looks like. So we have established the Howard County Chamber of Commerce enrollment portal. It is a secure HIPAA certified portal. And what we're asking is that you have all of your benefit eligible employees take 5 to 10 minutes to get onto this portal, to answer some health questions about themselves and any family members that they may cover. You're not going to get to see any of the information that your employees put into this portal. Howard County Chamber of Commerce is not going to get to see any of the information that your employees put into this portal. I don't get to see any of the information that your employees put into this portal. This information is collected and it is sent to the underwriters, and the underwriters set the rates based on that information. We need almost 300 employees to be in that portal in order for the underwriters to feel that we have enough spread of risk that we can have this program go live. So right now, our plan is to have the enrollment portal open until November 13th. And hopefully at that point in time, we have enough lives in that portal where the underwriters are comfortable. and we send that information off to the underwriters, and within about 2 weeks, they'll come back to us with the different rates for the different plan designs that are chosen. And we'll have a single rate, a husband-wife rate, a parent-child or children rate, and a full family rate for each different plan design. And every organization that chooses the plan design with $1,000 deductible is going to have the same single husband-wife, parent-child, and full family rates. So that's how the program works. But you as the business owner don't have to decide that you wish to participate or not until you see the rates for the different plan designs. So having your employees go into the portal and answer these questions does not commit you to being in the program. You don't have to commit to being in the program until being in the program or not being in the program until after you've seen the rates that we're able to set up for the different plan designs. So in just a minute, I'm going to show you guys what the portal looks like. But here's some marketing material that you've probably gotten already from the chamber, or you're going to be getting it. And on there is my name, and that's my direct dial office number. I know it doesn't look like a direct dial number, but it rings directly. Right now, it just rings directly to my cell phone because it's forwarded. And we've also set up an email address that I check a couple times a day for the county chamber, Howard County Chamber of Commerce, HoCoChamber at worldins.net. That email address is specific for your organization. So feel free if you want to send an email with any questions, concerns, etc. I check that again a couple times a day, and we'll get back to you typically within 24 hours. Before I go to the portal, just kind of want to conclude this.
Hey, Terence,
Yes,
before you go to the portal, we've got a question.
Okay.
And that says, please define benefits eligible. And so this person says that they have 6 employees, 5 eligible, but 1 that takes, they have 6 employees, 5 eligible, but 1 that takes advantage. And so if you could define what benefits eligible means.
When you see takes advantage, Medicare Advantage?
That might be what they mean. I'm going to actually, depending.
So the Affordable Care Act basically defines a benefit eligible employee as anybody that's working 30 hours or more a week. If you as an organization have decided that, well, you want to make benefits available to any employee that's working 25 hours or more a week, we leave that up to you to determine for each organization, for them to determine themselves what they consider benefit eligible. But the Affordable Care Act says it's 30 hours a week.
Okay, and it says here takes advantage of health insurance.
So they use it a lot.
Got it. Okay.
Every insurance program is going to have those high utilizers, and we just know that. That's just part of the process. So I'm just going to kind of walk through this last slide real quick before we go to the portal. But basically, this program is designed to give you guys the opportunity to gain control over your healthcare expenses while providing very high quality benefits to your employees. Simple. There should be cost savings. There's not going to be cost savings in 100% of the cases. We for whatever reason, we never get 100%. But the vast majority of organizations should see some savings. A lot of benefits to this program, but to me, it's the bottom bullet. It's the one that's bolded. It's the future rate stability. So as I said earlier, as I started this, HCS has put 50 of these programs on the books over the course of the 3 years that this plan's been in existence. And during that time, they've had 3 or 4 organizations see rate increases. And when I say organizations, I mean an association see a rate increase, and those were all single-digit rate increases. The vast majority of the associations that are in this have had flat renewals 1 year to the next. There have been a couple that they had such savings that they actually reduced rates. But typically what they find is that the leftover dollars in the claim bucket are offsetting any future medical trend that the actuaries decide medical costs are going to go up by 3% this year or 6% this year, and the savings are offset any of those potential trend increases. So that's typically what happens. But it takes the unknowing of, is this going to be the year of 15% or 25% or 4%? It takes that out of it. It makes you as a business owner, it makes it easier for you to budget from one year to the next what you're going to be doing. And now I am going to do a new share. If I can get this right, let's see, where is, okay. All right, let's hang on just a second for me. All right, and we're let's try my new share there. There it is. Okay. So again, is everybody seeing the screen that says 3 easy steps to healthcare savings? Leonardo?
Yep, we can see it.
Fantastic. So this is a marketing piece that's been put together with us and Leonardo and his team and HCS, and it's just, you know, kind of the 3 easy steps. Step 1 is, we've talked about, complete the online personal health questionnaire. Once we close that, we'll come back to you guys with plans and rates. You choose, you as the business owner, choose the plan or plans you want to make available, and then we take care of the rest.
And excuse me, Terence,
Yes,
just
sir.
for the group here, if you look in the chat box, you'll see where I've actually provided a link that will take you to the page that Terence has been referencing, which then has a link to the portal that he's getting ready to go over right now.
So this is our portal. It is available in both Spanish and English, and it's pretty simple. And I'll go through it with you and show you a couple things that, you know, we've turned 1 or 2 things off just so that that people know. So it's where obviously we're asking people for their first and last name, phone number and email address, a home address, and company name. That's obviously very, very important. Then some basic demographic information. We right now, this asterisk on Social Security saying that it must be answered, we're turning that part off. Eventually, if your organization is going to enroll in this program, we will need your employees' Social Security numbers. But for the purpose of going through this underwriting process, we're turning off the requirement for it. Tyler was not at a computer last night. He was traveling. He was going to take care of it first thing this morning. So this should be turned off very quickly. But we need people's dates of birth, et cetera. And then whether or not they use tobacco. And then, are you adding a spouse or a domestic partner? If you click the yes box, there's going to be information pops up where we're looking for the spouse's name, number, that type of stuff. Are you adding a child or children? Click the yes box. Child 1 comes up. Are you adding a second child? Click the yes box. Child 2 pops up. On and on and on. So if you got an employee that's been very, very aggressive and has 5, 6 kids, well, we can have 5 or 6 boxes pop up for them. So it's just, you go on and then you're answering the question for everybody in the family. And so, have you had cancer? Have you had diabetes, cholesterol? Have you had high blood pressure? Or do you have high blood pressure? If so, what are your ballpark most recent readings? That's what we're looking for. And later on, what type of medicines are you taking for that high blood pressure? So,
hey, Terence,
yes, sir.
If you could speak to, and I think you mentioned it earlier, but if you could just speak to, as people go through this pre-enrollment, talk about the compliance with ACA and the pre-existing conditions and so forth. That's a question coming from the Q&A here.
Absolutely. So this underwriting process is not designed to exclude anybody from coverage. It's not designed to put any pre-existing condition exclusions on anybody. In fact, we can't do that. What this underwriting process is designed to do is for us to understand the risk of this group so that we can set the proper rates up front. As I said earlier, the last thing we want to do is come in with a rate right now that on average saves your members 20%, but then next year, because that rate wasn't really reflective of what the risk of the group was, the health of the group, we have to raise everything by 40%. So what this underwriting process is designed to do is for us to understand the risk so that we can set the right rates up front, and so that we have that stable rate base from one year to the next to the next. Yes, things are going to happen that are unexpected, that are not thought of now, and that's why we have the stop loss insurance. But this is not designed to exclude anybody or put any pre-existing conditions on. And so we just go through, and most of the stuff people can answer off the top of their head. Is anybody pregnant right now, et cetera, et cetera. And then you have to certify that you're not a robot. I love that one. And then you submit the form. And it goes to the HIPAA certified portal, and it stays there until we gather all the information up and send it off to the underwriters. And so that is pretty much it. Are there more Q&As in there, Leonardo? I don't see any open questions.
Yeah, I don't see any additional questions, but certainly I'll take this time to just ask if anyone has any additional questions. Certainly feel free to ask those. We want to make sure that you have every opportunity to ask any questions that come to mind, and that way we can make sure that we respond accordingly. The one thing we are doing in the event that you have additional questions later is this session is being recorded, and ultimately we'll have it linked to the chamber site. It will be on our YouTube channel as well as on our website. So if you want to go back later and kind of scroll through it or what have you, fast forward to some areas that maybe you wanted to look at again, you'll certainly have that opportunity as well.
And please also, you have the Howard County HoCoChamber at worldins.net email address with questions, and then you also have my phone number with questions, and I'm here to answer any of them. If people want to get unmuted and ask questions directly, Leonardo, I'm happy to handle them that way, or if there's, if they'd rather put them in writing, I'm happy to do that as well.
Sure, and I would definitely be able to do that, but looks like I guess we're good with the questions that have been, or at least the content that has been shared thus far, and certainly won't want to keep people any longer than we have to. And so I'll simply just thank all of you for attending today, and certainly if there's any questions, again, you have Terence's information that's on the information provided, as well as on the link that was shared in the chat box, and look forward to seeing you at future chamber events in the near future. And Terence, thank you for your continued support, and that'll conclude the presentation.
Thanks, everybody.